Hi, it's Dr. Whitten, and I've had some requests to talk about what I teach in the three-part Whitten Method Basics series. So today we're going to talk about and demonstrate Module 1, Structural. If you like this video, give it a thumbs up and hit subscribe and hit the notification bell too, so you always know when we upload a new video. The basic premise of the Whitten method is to communicate with the innate intelligence of the person's body to discover what corrections need to be made. In a minute, I'll do a full demonstration of this, so stick around for that. In Module 1, we learn how to muscle test in a way to get clear yes-no answers. We learn what muscles to test, how hard to push, what direction to push, how to stabilize yourself, and how to phrase the questions. Once we're able to get clear yes-no answers, we can get answers to all kinds of questions. In Module 1, we cover body work, how to find places that need massage, fascial release, trigger point therapy, and how to correct bones that are out of alignment. So in Module 1, we're going to cover so many different things. We're going to teach you the number of vertebrae in the neck, thoracic, lumbar, pelvis, how to palpate and find T7, let's say, or L5. So we go over the anatomy and the anatomical landmarks so you can find any particular vertebrae. But as far as like checking where she needs massage, we can just say, are there places in her body that need massage? Yeah, more than one? Yeah, more than two? Not more than two, so her body says it needs massage in 2 places. Where? Not in their chest, not abdomen, not the neck, not the upper thoracic, okay? Not left upper thoracic, okay? So we know it's in the right upper thoracic is one of the 2 places, right T1, right T2, right T3. So that's in the upper back here. So with this hand, we can muscle test where she needs massage. Right there, okay. Is that sore there? Yeah, she's grimacing. So we found one place. Where's the other place? Right lower thoracic, left lower. So roll up here. So we can hold that, hold strong. Good, good. So as a massage therapist, you can use this to find exactly where the person needs massage. And we would do the same thing for fascial release. So if we said, are there places that need fascial release in her body? Yes. So we can use muscle testing to get yes-no answers. Are there places that need fascial release? Her body says yes. Is there more than one place? Is there more than 2 places? Is there more than 3? So in this case, we've got 3 places. So with fascial release, we not only need to find the location where the fascia is stuck, but we also have to know what depth in the tissue that the fascia is stuck, because it could be superficial, it could be very deep, it could be somewhere in between. And then we also need to know which direction to push the fascia. In other words, let's say the fascia is stuck here, we need to know what depth and if we should push up or down or at some other angle. So with muscle testing, we can determine the exact location, depth, and direction or vector to push it in. So that's extremely helpful to do precise body work. Great for rolfers as well to get more pinpoint accuracy on the fascial release work. And then with trigger points, she has some trigger points, more than 1 significant trigger point, more than 2, more than 3, more than 4. So she has 4 significant trigger points. See, we're just talking with the body. The body knows everything about itself, right? Her brain has all the data about what's going on with her body. So trigger points, the most significant trigger points not in her neck, chest, abdomen, T1, T3, T4, 5, 6, T7, T8, T9, T10, T11. So we could say left T10, 11. No, okay. So right T10, 11 is the most significant trigger point. So roll up here. I'll use this arm to test. So the bottom rib goes to T12, hold strong. So if we're looking for trigger points goes weak right there. So we can get, you feel that spot right there?
Yeah.
Okay. So sometimes we can be like a millimeter off, so they'll tell you when you've got the spot exactly right. And then you just hold that. So it enables you to do very precise body work, soft tissue work. And then as far as adjustments, we can check C1's in place, C2, C3, C4, C4 left posterior, C4 left lateral, C4 right posterior. Posterior means the back side. Lateral means the side of the neck. So it's saying posterior. So the first bump coming down from the skull is C2. So I found that spot. So I'm going to go to the right and then down one vertebrae. There's C3. Here's C4. Muscle test goes weak. So this is a bone that's out of alignment. So if I push it towards the midline, that doesn't help. If I push it straight up, that brings her to strength. So we know that's the way to correct it. And if you're not a chiropractor, you would just hold that bone. You would just hold it until the muscle's released. And it might take a minute to align. She just took a deep breath, which usually indicates a release has just happened. So anyways, these are some of the things we cover in Module 1. And there's some other things as well related to stretching, finding out which muscles are too tight and too weak. So we cover a lot in that. But that's kind of the basics of what you'll learn in that module. If you're interested in learning this work, click the link in the description below to get started and leave any questions in the comment section below. Thanks so much.